What are biomarkers for Facioscapulohumeral Muscular Dystrophy? Imagine trying to understand how a disease is progressing without opening a patient's body. That's where biomarkers come in. They are measurable signs that tell us about the state of a disease like Facioscapulohumeral Muscular Dystrophy, or FSHD. These indicators can be molecules, genes, proteins, or even images from scans. They help doctors diagnose, monitor, and evaluate how severe the disease is and how it changes over time. The main genetic biomarker for FSHD involves changes in a specific part of our DNA, called the D for Z for macrosatellite repeat on chromosome 4. Normally, this region has many repeats, but in FSHD, these repeats are contracted or shortened. This contraction leads to abnormal activation of a gene called DUX4, which is normally silent. Genetic testing that looks for these changes is considered the most reliable way to confirm FSHD. However, sometimes genetic tests may not give a clear answer, especially in early or atypical cases, so additional biomarkers are helpful. Another important type of biomarker involves gene activity, or what we call transcriptomics biomarkers. In FSHD, the DUX4 gene becomes abnormally active in muscle tissue. Scientists can detect this by looking at the expression of DUX4 target genes in muscle biopsies. Interestingly, researchers have developed a blood test that measures a set of 143 genes whose activity reflects what's happening in the muscles. This blood-based biomarker correlates with how severe the disease is and offers a less invasive way to monitor disease progression over time. In addition to genes, proteins in the blood can serve as biomarkers. For example, certain mitochondrial proteins and immune system markers like neutrophil extracellular traps are found at higher levels in FSHD patients. These can be measured using blood tests called enzyme-linked immunosorbent assays. Elevated levels of these proteins indicate muscle damage and immune response, giving clues about how the disease is affecting the body. Imaging techniques like magnetic resonance imaging are also valuable. MRI scans can reveal muscle changes, such as fat infiltration and inflammation. Specific MRI patterns, including hyperintensity signals and fat fraction measurements, help distinguish FSHD from other muscle disorders. These imaging biomarkers are non-invasive and can track how the disease affects muscles over time, providing a visual map of disease progression. Finally, analyzing muscle tissue directly through biopsies can reveal molecular signatures unique to FSHD. By comparing affected muscles like the biceps to unaffected ones, scientists can identify gene expression patterns that predict the disease with high accuracy. These molecular signatures deepen our understanding of FSHD and can guide the development of targeted therapies. In summary, biomarkers for FSHD include genetic tests confirming D for Z for contraction or epigenetic changes, gene activity signatures involving DUX4 and PAX7, blood protein markers, and advanced MRI imaging. Combining these tools allows for better diagnosis, assessment of disease severity, and monitoring of how the disease evolves. Always remember, if you or someone you know is affected by FSHD, consulting healthcare professionals is essential for personalized care and management. These biomarkers are powerful, but they are part of a larger picture that includes individual variation and ongoing research.